Alright, I started.
Hi everyone, I'm
Carter. I'm Bardia.
And now Abhinav.
and we're going to be going over the health gap and uncovering hidden relationships in health in Richmond. So to start off, we wanted to look at health disparities, which are influenced by many different things, including income, education, race, ethnicity, and access to healthcare. These disparities can change a lot about someone's health and how long they live, and we're specifically going to be looking mostly at income. So our goal was to visualize the relationship between health and many different factors in Richmond and analyze these health disparities between different groups. We're trying to uncover new correlations and create policy solutions to address these inequities. For the sake of time, we used some pseudo data and we weren't able to analyze all the factors we wanted to, but our analysis and our method should still work. Our problem starts with understanding how there's different correlations between health and other social determinants, and we're trying to visualize that. We developed a program that will output a heat map and a Spearman rank correlation to visualize the relationship between these factors. So for our analysis, we leveraged publicly available data to identify the difference between pet licenses in the city. And we found that they're mostly in the western end, which is where there's a higher income stratification compared to the eastern end. And because this data was not standardized for population density, the population density in the west end is actually even less than in the east end. So that would make the actual concentration much higher, which is not as clear in this data, but adding the data for the population density, it's really easy to visualize. We also created a Spearman correlation graph where we went to the different districts and correlated how much the pet licenses existed there. For other analysis, this is in the future, we didn't use this using our own application, but we also compared mortality at the top, impervious surfaces in the middle, and canopy coverage at the bottom, which shows that there's a clear relationship between green spaces and increased life expectancy. And these areas also correspond to higher income, because the east end of Richmond is also the richer end of Richmond. And the western end is richer, and the eastern end has lower income, which also is clearly visible here. So for our proposed solutions, basically we're saying that nature saves lives. We want to promote the adoption of dogs at animal shelters and also help introduce government programs that can subsidize these adoptions and give people access to things like dogs. That way they're more motivated to do things like take walks and just get that serotonin from their pet, which hopefully increases their life expectancy. Additionally, we want to increase vegetation and park spaces on the east side of Richmond so that people have places to actually walk their dogs, and also because that correlation finds that it's correlated with higher income as well as higher life expectancy. Thank you.